Someone once told me that I should get used to people staring. So I did. It's okay, you can stare. When you're a two-time gold medalist, it comes with the territory.
Hello, I'm Maureen Reedy, the President and CEO of the Paley Center for Media, and it is my great pleasure to welcome you to a very important and timely PaleyImpact program titled Media's Role in Preparing for Life After COVID-19. This program is made possible by our invaluable partner for so many years, the Blanche and Irving Laurie Foundation. We'd also like to thank the Isermann Family Foundation for their support, and we extend a very warm welcome to our dear friends, Jean and Scott Korf, and thank them for their continued generous support of the Paley Center. Today's program could not be more topical nor more relevant to the role that media plays in our lives. For almost 18 months, we have been dealing with the effects of COVID-19 on our society, our daily lives, and in our institutions. As increasing numbers of Americans are vaccinated, there is great excitement about the return to many of the treasured experiences that we have been without during this challenging time. Yet vital questions remain. How will government, schools, businesses, sports and entertainment venues, and other vital parts of our culture adapt to establish the new normal? What have we learned about the healthcare system, our federal and local leadership, and ourselves that can be put to use in the event of a future crisis? What is media's role in keeping Americans informed about the still ongoing pandemic and in helping reclaim some of the long absent parts of our lives? For this most important conversation, we have gathered leading voices in government, healthcare, education, and media to help us understand the challenges we continue to face and the lessons we've learned from this trying time. Never before has Paley's mission been more vital, as media has been the undisputed connector to a nation in these unprecedented times. Paley is uniquely positioned to meet this moment with impactful conversations led by influential leaders such as the esteemed guests that we have with us today. They will share their insights into media's role in keeping the American public informed about preparing for life after COVID. We welcome to our conversation Dr. Nahid Badalia, Founding Director of the Center for Emerging Infectious Diseases Policy and Research at Boston University. Erin Burnett, CNN anchor and host of Erin Burnett Out Front. James Clyburn, United States Representative from South Carolina and Majority Whip. Elise Jordan, political analyst for NBC News. Dr. John LaPook, Chief Medical Correspondent for CBS News. Tommy Thompson, former governor of Wisconsin and president of the University of Wisconsin System. And Michelle Williams, Dean of the Faculty at the T.H. Chan School of Public Health at Harvard University. Now, before we start the program, there's one brief housekeeping note. If you are tweeting, our hashtag on Twitter is hashtag PaleyImpact. And now I'm so pleased to welcome our moderator, Juju Chang, the Emmy Award-winning co-anchor of ABC News Nightline. She also reports regularly for Good Morning America in 2020 and recently co-hosted the ABC News Live special, Stop the Hate, the Rise of Violence Against Asian Americans. Please join me in welcoming Juju Chang.
Thank you so much, Maureen, and thank you everyone for joining us today. I'm so honored to be here as part of this distinguished conversation. I'm Juju Chang. I'm the co-anchor of ABC News Nightline, and it's great to be here with you for PaleyImpact. Today, we're going to be examining the media's role in preparing for life after COVID-19, post-pandemic, as we like to say, once we start looking at the pandemic in the rearview mirror. And to join us in this conversation, we have an august panel. I'd like to introduce them and talk about raising awareness in media circles for reimagining the new normal or redefining it. We'll start with Dr. Nahid Badalia. She's the founding director of the Center for Emerging Infectious Diseases Policy and Research at Boston University. And we have Erin Burnett, CNN anchor and host of Erin Burnett Out Front, and Congressman James Clyburn, representative of South Carolina and of course Majority Whip. And Elise Jordan is joining us. She's a political analyst for NBC News and MSNBC. Dr. John LaPook, Chief Medical Correspondent for CBS News. So many heavy hitters today. And Governor Tommy Thompson, former governor of Wisconsin and current president of the University of Wisconsin. And last but not least, Dean Michelle Williams, who is the Dean of the Faculty at the T.H. Chan School of Public Health at Harvard University. Thank you all for joining us and welcome. We're going to go around the horn, as they say, and give everyone a chance to weigh in on the central question, which is, in a few words, what do you feel is the most important thing that the media can do to help prepare people for life after COVID? So, Naheed, let me start with you.
Thanks so much, Juju, and thanks for tackling this important topic. I think, my experience having dealt with outbreaks as a responder and then being in communities that have been affected by this, the important thing is that we recognize that everybody wants to go back, that after a societal upheaval at this level, you don't go back, you go to an after when it ends. And that requires recuperation. It requires looking after communities that are heavily affected and requires building resilience so it doesn't happen again.
It's a good point. Instead of going back, Erin, how do we move forward?
Well, I think, Naheed, you raised a really great point. I think as media, in terms of what we cover, people like John and Juju and I, it's staying involved with some of the communities that are hardest hit, that are going to be some of the last to get a lot of the things that are needed to improve from this, both, in terms of vaccines, but also economically. We're in a huge transformation. I also think internally, we can be leaders in terms of flexibility and what we provide for our workforces and trying to be creative in what we envision and kind of a once in a life opportunity to help us recruit and retain people in a way that we haven't been successful at before.
Great thought points. Representative Clyburn, what would you say is the most important thing media can do?
Well, as you probably know, I'm a lover of and a constant participant in studying history. And I think that history has to be our guide. I think about today, there's so much reluctance on even getting the vaccinations. I've been having town hall meetings and having a fifth one tonight and a sixth one tomorrow night. And I'm amazed at the number of people who have not been informed as to why it is important to get the vaccinations. So I think the most important thing we can do is to really share with people what the facts are. This entire effort was launched by a president who just did not tell the truth to the American people. And we've got to take it upon ourselves to begin to tell the truth. And you got to look at the history in order to do it.
And so, Elise, how do we get the message out to the citizenry?
Well, I'd like to build on what Congressman Clyburn said, and absolutely, it's all about empowering people with accurate information. And so I think that with so much quantity swirling about and not quality, there's more emphasis than ever on the media getting it right and on questioning public officials, quite frankly, to make sure that they're telling the truth so that lies that are truly life or death for too many individuals are not allowed to fester in today's information ecosystem.
And John, with the many platforms at CBS News, how do you get the word out?
Well, I would build on what others have said about the importance of really embracing science and conveying to people what the facts are. And I think especially now, I think we've had this all along, but especially now, getting them comfortable. I know we're all uncomfortable with embracing uncertainty, but that has been part of the pandemic. And I think confusion has come from the fact that people are saying, wait a second, you said this today and that tomorrow. Well, as a physician, I'm very comfortable with the fact that what I say today may be wrong tomorrow. I think we haven't done the best job conveying that to people, that here's our advice based on the facts today. And then here's what we think. Now there's new facts. We're going to give you some new recommendations. And I would just add, I think we really have to have empathy for people as they re-enter this next phase, because things are changing. We have this Delta variant. Maybe the recommendations that one person is giving that's good for one person isn't good for another person. Some people feel more comfortable still wearing a mask indoors, even if they're double vaxxed. Other people don't. And I really think we have to be empathetic for them, understand they're going to be PTSD in the days and years to come. They're going to be ACEs, the adverse childhood events and experiences that a generation of kids are going to experience. So I think we really have to not think, well, this is over, we're emerging from the pandemic. We have to say, yes, next phase, but we still have to embrace science and embrace empathy.
Outstanding. And Tommy Thompson, how do we as media entities and as a society communicate and prepare people for life after COVID?
Well, first off, let me tell you that I represent 26 campuses, 170,000 students, and I kept all my campuses open. And I'm going to open up this year. And what the best thing the media could do is to start giving the right information out about vaccinations. More information, more straight, more scientific. Instead of trying to beat up on President Trump's transgressions or his mistruth, why don't you give him credit for getting a vaccine? It was unbelievable that a vaccine could be created in 12 months, and give him his credit, and then move on and say the vaccine is viable, it's correct, it's good, and let's forget about beating up each other and going forward and saying vaccination. Take a look at the hospitals. The vaccinations are the things that saves people from going to the hospital, from getting intensive care and being individuals that die. I want my students to be vaccinated, and I need your help in order to get the information out there to do that.
I think everyone would agree that removing politics from science is an important goal. Yes, Dean Williams, would you care to weigh in on this?
Yes, I would add to what my distinguished panelists here have said and say that it's really important that we consider framing. And I'm thinking about this in the context of the big debate right now about boosters, yes or no, or when. And I think what we have to do is everything that our panelists have said, but I think it's very important for the media to take the lead in framing and adding context to the conversation. It is about delivering the scientific fact, but it's also framing it in a way that a diverse group of listeners and participants who need to hear this have access to the information in a way that is actionable and relevant to where they are.
Representative Clyburn, you are known for being very close, in close touch with your constituents. Tell us expand on this idea of town halls and the different channels in which you can communicate and what you're hearing back in terms of, preparing for life after COVID and dealing with vaccines.
Well, the reason I talk about the history is because I think we're being a bit short-sighted. We don't understand that the Tuskegee experiment is very much in the minds of people of color. If you don't understand that the differentials between the polio vaccine, and there were differentials, there were two polio vaccines, Jonas Salk and Albert Sabin. The Jonas Salk was a shot in the arm. Albert Sabin was a drop of serum on a lump of sugar. I need not tell you who got the drop of serum on a lump of sugar, and who got the shot in the arm. And so what we've got to do is face the history here and work to overcome that, dispel these notions, because people are very, very suspicious of messengers. And so if we're going to have messengers, let's make sure they're messengers that people can identify with, people trust, and know the history, even the vaccines. I've seen Fauci having to explain to people, wait a minute, the Moderna vaccine, the leading the scientist on that was an African-American woman. And so that's the kind of credibility that you're going to have to face here, that if we really want to get people vaccinated. It's just not going to happen any other way. And they've got to understand, last night, it was a shock to people when I told them, I just got new numbers here, 99.5% of the people who are contracting the virus today seem to be people who have not been vaccinated.
Right. And that's an important part.
To people.
Yeah, that's an important part of the messaging that needs to go out. But Dean Williams, let me ask you to double down on that. We at Nightline have done stories about how it's this history combined with modern experiences with underserved communities that is adding to this vaccine hesitancy. What do you think needs to be done to address that gap, especially in underserved areas?
Yes, Juju, that's such an important question. And I would say that it begins with our having to reckon with the mistreatment, the discrimination that the Black, Latinx, and Native American community have experienced in this country. I think that is a first off. Then we also have to then recognize that we do have a structural flaw in how we communicate health threats and responses to health threats in our country. We generally design and distribute information with the middle class in mind, and we don't really think about vulnerable populations or populations are not in the media mainstream. And by the time we get to that population, the threat has really evolved to something that is of an epic proportion that is out of control. And I'm just thinking about the early onset of testing and understanding the dynamics of the spread of COVID-19. So I think we have to reckon with the history. We have to reevaluate how we communicate health threats broadly, where we have to prioritize communicating to vulnerable populations. And then we have to be very, very thoughtful and careful about using the diversity of our country, the diversity of our population as our superpower. In that meaning, make sure the message is delivered across multiple platforms. Make sure we are thoughtful about who the messengers are, and also be very intentional about meeting people where they are by recognizing what the limitations might be in implementing on testing or getting vaccines. Are there transportation issues? Take a systems-wide approach in messaging and creating the message to communities of color.
I'm going to pick up on what Representative Clyburn says, and I know we've done stories about how designating people in the community who are trusted, whether it's Black pastors or people who are leaders, and then bringing the vaccine to those communities can meet constituents where they are. Governor Thompson, let me turn to you. You have shown bold leadership in getting students back on campus. I know you're going to, as you pointed out, be fully in person in the fall. How do you best communicate to people my oldest son's age who are mostly on social media and not necessarily even watching traditional media where mom's hanging out?
I was absolutely amazed when I took this job a year ago that people don't read the newspaper and don't watch television that much. It's all on social networking. And so I have to go out and I have to communicate with my students the same way that they're going to get the information through social networking. Get as much information as I possibly can, scientifically, that's correct and not biased, not political, but straightforward and honest, and say, we need everybody vaccinated. You can't come on campus and without wearing a mask unless you're vaccinated. You can't come on and go to class unless you're vaccinated. And it's going to be to your benefit to be vaccinated. You're going to protect the professors. You're going to be in person teaching. And we need you to be vaccinated, every single person and student. And I'm surprised, but social network seems to be the only way that really works, Juju, to get their attention. Your oldest son is like everybody else, like my granddaughters. And that surprises me, but it's what really is happening out there. So I'm trying to do my best to use the media that they use to get the information out.
I just want to see what your TikTok dance looks like, President Thompson. I'm going to move.
I didn't even know what it was before I got here. Now I'm an expert on it.
Aaron, let me turn to you. When you're booking your show every night, what are you thinking of in terms of your lineup, in terms of how to best communicate the complexities of what we're facing and how we can reimagine what this new normal is going to look like?
Yeah, I mean, it's so interesting hearing all this because it is a challenge, and I know you deal with it as well, right? You want to tell the stories, but the facts change, right? Science changes. So we're trying to capture it. I mean, social media is moment by moment, right? But we're day by day. So we have been really lately focusing on people who have gotten vaccinated after vaccines are widely available and the reason they're choosing to do so. And there are people who are speaking out, and often, with great harassment on social media and things like that. And many of their stories are very tragic because they're getting vaccinated because someone in their family died because they chose to not get vaccinated. So we're doing that as one thing on these personal stories, just to continue to do that. We had a person on recently from Florida. I know you all remember the Florida government organization, right, where one person who didn't get the virus was vaccinated, and among the others, several were extremely sick and some died. And the wife of one of the men who died was still not comfortable telling people to get vaccinated. And it was a pretty powerful thing because she still felt that way. And, you have to, she just lost her husband. So it's a small and slow process. And that's on the personal side. One other thing I'd say, Juju, though, is on the science side, this is the challenge we face. So this whole issue of the vaccine works and it's our only way out, and we all know that. And yet that doesn't mean it's perfect, and no one says it does. Conveying those two things at the same time is really important, because if you tell people it's perfect and then that 99% number goes down a little bit, you don't want them to feel that suddenly they were hoodwinked and it wasn't legit. So like in Mississippi, hospitalizations are now 12% of people who are fully vaccinated. And a week ago, that was 5%. The vaccine's still the best way out. We have to convey that to people while also acknowledging those facts. And I think that's one of the big challenges that we have in terms of how to do that. So we'll put on Dr. Collins, formerly, NIH, we to try to keep asking these questions. But I think that's one of the big challenges that we have.
So, Dr. Badillo, when you're a guest on Aaron Burnett's show, how do you communicate, again, the complexities of the Delta variant or the vaccine hesitancy, and keep it conversational and keep it sort of accessible for people?
Juju, this is really hard. And it's actually particularly hard for someone like me who comes from a technical perspective. And this last year, contributing to the media in this fashion has been a challenge to try to sort of speak in this in a personable manner, as Aaron said. The trouble here is, as multiple people have said, with emerging infectious diseases, one of the basic challenges is that data changes all the time. And that's a challenge not just for media and policymakers. It's actually a challenge for public health officials and physicians on the front line who are dealing with these patients, because we're all learning about these infections, about these diseases. We're learning about how these vaccines will actually play out. So it's hard to predict, right? The couple of things that I've sort of done is try to put it in context of ways that people experience, the metaphors that the people experience. So Aaron, to your question about Delta and explaining why people who are vaccinated may still get infections, I've used this idea of, if it's downpouring outside, if your vaccine's your raincoat, you're still going to get a little bit of wetness. So you might want to use another umbrella, like mitigating layers, and it's complex, but it's beyond just turning it into vernacular terms. The other difficulty is it's because there are forces of misinformation and disinformation that are taking advantage of this, difficulty, this challenge of emergent knowledge, and politicizing that. And you see that particularly, in two ways. You see that through just politicization of public health officials. We talk about trusted, messengers, and trusted messengers where are public health officials. And throughout this last year and a half, you've seen public health officials become the lightning rods, which are in this political divide that already exists. And so, how do you get the message out when the messenger is itself, herself, or himself been politicized? The other is targeting of disinformation in communities. To Dean Williams' prior conversation about targeting of communities that may not be getting information from mainstream media. And you're seeing that from anti-vax, communities. You're seeing that in going into immigrant communities, into communities of color that may access different, medias, or Orthodox Jewish communities that may access other information. It's filling voids of information. And I think one good thing media could do is try to figure out how to reach those very different, diverse communities that are already being targeted by disinformation agents.
Interesting.
Juju, if I may just step in for 1 second and say, we do fire drills to prepare for fires. And what we have to do, what my colleagues have just said are all perfect. I would say we also have to move upstream from the immediate problem and think about where we are lacking in having a population with a health literacy that is sufficiently high for people to start to take the information and really use it in a way that enhances and improves and protects their own health and wellness. And so we have to think about upstream health, addressing the health literacy issue, and also allowing a population to have analytical and critical thinking so that they can appropriately identify the best sources of information. Who are the messengers that are giving messages based on facts and evidence and science? And so I just wanted to add that moving upstream is also going to be an important thing. And it's what we will all have to do outside of the media and with the help of the media.
It's a great point. John, where do you see the gaps and where can we do better?
I love what Michelle just said, because moving upstream is so important, especially when you look at the bigger picture. We have a public health system in this country that's been way underinvested in. And it's not, we can't just sort of suddenly have the crisis on our hands and then say, oh, gee, we should have done this for the last 20 years. So we've got to invest much more in public health system. We all know that there are local healthcare systems, local health departments that are still faxing results to each other. We don't have an integrated national health system where the state's computer systems are handshaking with the government systems, and we can just get information like that. The other thing I would say is there's been a parallel story that I find very interesting that's crucial for the future throughout this is the interdisciplinary interactions that we've seen. We have learned so much from the aerosol scientists, right? So people like Kim Prather and Lindsay Marr and Don Milton and Joe Allen, who's with Healthy Buildings. We have to start thinking, wait a second, they taught us it's in the air. It's in the air at a time when the CDC wasn't saying that, when the WHO wasn't saying that, because there were going to be implications about, gee, if it's spreading like tuberculosis, we have to do certain things. But, I know behind the scenes, I sort of connected them with Tony Fauci, who then spoke to with the White House task force, and the word started to get, to them. And Tony, to his credit, said, hey, I'm learning new stuff that I didn't know. So we have to, going forward, and I think it's going to be helpful in terms of all communities, especially ones that don't have a lot of money, to think about how do we make, yes, we have to get everybody vaccinated for sure. We have to have healthcare literacy. There's been incredible inequity in health. But one of the things that we can do physically is make the buildings healthier. Understand we have to increase ventilation. And this gets to the issue of multi-layers of protection. It will be vaccination leading the way, but it's also ventilation and all the other stuff we talked about, physical distancing and washing hands and changing our ethos as a culture of saying, well, I'm sick, I'm going to still tough it out, I'm going to go to work. No, you're sick, you want to do something for us? Stay home and don't send your kid to school with the sniffles. And I'll end with the fact that I'm really worried about this fall. We already have respiratory syncytial virus. We're going to get colds. We're going to get flu. It's going to be very confusing for people to know, is it COVID? Is it something else? And we have to start doing more home testing. And we have to not make it $30 a test. It's got to be $2 a test or something like that. And that's the way we can help get back to school safely.
Just a quick follow-up for you, Dr. LaPook. Do you feel like mask wearing will be here to stay in some subset like it is in Asian countries where people, if they have a cold, they wear a mask? Yeah,
I think it should, and it's not necessarily to protect yourself against COVID, which will be endemic, and we could talk about the variants and what could happen with that. But yeah, I was talking to my wife about this, about when we go back to Broadway, I might even walk in without a mask, depending upon the ventilation in the building, right? But I think once the lights went down, why not put on a mask? I don't need to get the cold. Forget about COVID. I don't need to get the respiratory syncytial virus or the other variant of coronavirus, which is just a common cold. So yeah, I think the answer is yes. And I think as part of that, right now, we're in the situation where with the variants and with people getting breakthrough infections, even though they're double vaxxed, the idea of what you should do indoors, I think people are rethinking that. And maybe you do still want to wear a mask, although that's not the official CDC recommendation yet.
Elise, let me ask you to shift the frame a little bit and look at our culture and how it addresses children. Like we're seeing outbreaks in summer camps. We're looking towards, as Governor Thompson is, kids returning to school in the fall. How do we communicate, especially for the unvaccinated under 12 set, what needs to be done to prioritize children in this equation?
Big picture, I hope that this doesn't become even more of a front in the culture war when it really is a public health crisis. And I'm hoping that some of that ground has been reclaimed a bit as the temperature has been cooling down surrounding this overall debate. But when it comes to children, how do we depoliticize their health and get the facts out there as to what is healthy for children, what's not healthy for children, and what's the best course forward? And you look at, another panelist mentioned Mississippi, where there are some children, 6 or 7 children who are reportedly in ICU with coronavirus, and they reportedly have other conditions, but still that's very scary that 2 children are on ventilators in a hospital and in a state where there's the lowest number of vaccinated adults. And so tying together how protecting yourself as an adult protects children and takes away that tough choice and eases perhaps the tough choice that parents might have to make over whether to vaccinate their child or not. This has just been completely eye-opening to me, the pandemic, just how it has affected women, especially, and how it's affected parents with children. And you look at our culture on the whole and our society and how we view work and how we encourage women to have more children, but if the child's sick, if there needs to be childcare, there's no option, and then they end up giving up their employment. You look at how many lower income women have been forced out of the workplace completely. So I hope that this is a moment of great reflection for the country, and we look at how we want to have all members of the country participating equally in society.
And you just ticked off a number of COVID adjacent stories that are important to illuminate, as Dean Williams says, the frame, the context of how our country is getting through this pandemic. Governor Thompson, I'd be curious, we talked about this idea of restoring faith in trusted media personalities, public health officials, et cetera. How do we move forward in spotlighting the truth in a more sort of even, non-divisive way?
Where's our biggest problem? Our biggest problem is in underrepresented, underserved individuals and young people. Let's start putting young people on the screen. Let's start using social media. Let's start getting college students that are vaccinated telling their fellow students why they need to be vaccinated. Give up the mask, give up the testing, but get vaccinated. We're going to have parties on all of our campuses when students coming back. Beer and brats. Get a poke for a brat. And we're going to be out there publicizing students, especially underserved students, that they're going to tell the story themselves why they got vaccinated. And that's going to be more telling to the young people. And that's where we have the biggest dearth of vaccinations right now. That's what I intend to do. And I think it'll work better than mass media.
We have such a great distinguished panel, and I can't believe how quickly we're running out of time. So I want to give everybody one last round as a final thought to take us out. But Dr. Bedelia, let me start with you, and we'll work backwards.
Yeah, one thing that I hope the media does more of is pay attention to the global scene, where if there was ever a time our connectivity is sort of displayed on full, it's now. And if we don't achieve that global vaccine equity, we're going to continue living in this pandemic. This devastation worldwide. You're about to see 95 million more people get pushed into extreme poverty. You're seeing decades of work on education and child health and immunizations get just destroyed, devastated, that we're going to have to rebuild from. And that's not to add to the domestic trauma that we're going to, as we talked about and started with, but really to pay attention to the global eye, because we definitely are all connected and trying to get back to normal.
And the vaccine gap there between North and South. Dr. Bedelia, thank you for that note. Erin?
So I would second everything you just said. So I'll make just a different point, because I agree with all of it. And I think it's our big challenge in the context of everything you're seeing with unrest around the world, whether it now be Lebanon or Haiti or Yemen. I mean, all these things are related, and it's incumbent on us to make those points and to cover it. I'll just go back to the point I mentioned at the beginning, which is I do believe on the internal how media organizations are structured, we have an incredible opportunity to re-envision how things are done. And we have learned, like every other industry, that we can do things differently. And I think right now there's a great push to go back to the way things were before, because it's what people know. I don't think it's what most people want. And I think it is, we have seen people prove in all sorts of aspects of this work, and I'm talking about broadcast, that people can do work in different ways and from different places. I think if we can be creative with that, we can get more voices. For example, I think we should stick with some of the technology we're using. Instead of having the shuttles between New York and Washington full of people going for 3-minute panels on a show, we should be taking more people from WebEx, and we can get more voices and more diversity. So certain things should be permanent. And in terms of our staffs themselves, we can retain more people if we don't have multiple hour commutes per day. We can retain more women after they have children. We can have a more diverse, better workforce. And I hope that we can be leaders in that. And I don't think it happens right away. I think it was you, Nahid, who said, look, when you come out of this, you're not coming into the way it was before. And you're going to figure out what it is. And that by definition is not just like turn on the switch. Here's your 3 options is what it's going to take a little time. We have to have that flexibility, even though we desperately crave certainty. But I really hope that we can do that, because I think it will make a huge difference.
It's a really smart point. Representative Clyburn, closing thought?
Well, thank you very much for having me. Yeah, I think Erin is absolutely right on with that. These traditional notions, we've got to get beyond. All that we've talked about here today about communicating, look, I believe that broadband is to the 21st century what electricity was to the 20th century. We've got to know that we are not going to get the message out to people. We are not going to get healthcare delivery. We're not going to get our children educated if we don't put broadband in every home. And that's how we're going to have to communicate. And this whole notion that infrastructure has got to be traditional stuff, it ain't traditional. We got to look to the future and what we know is going to be in our future and utilize that going forward.
And I think that's totally right. COVID in many ways exposed the Wi-Fi divide. I spoke to folks who didn't have access to Wi-Fi for their children or didn't have the tablets, whereas others could distance learn comfortably from home. And I'm impressed with your broadband skills, Representative Clyburn, so thank you. Elise, your closing thoughts?
No, I want to second all of this, that we need to throw away the old rule book if we are going to participate as media in this new era of so much disinformation. And, you just look at the switch from a top-down mass media model to a down-up social media model, and you have legitimate press outlets competing with just downright rascals who are unwilling to censor themselves if it's going to impede their click and the dollars coming in. And you also have algorithms that are geared towards spinning out that kind of disinformation, which is another part of the equation that we have to deal with. Just what are the limits with the tech giants and misinformation in these times of huge crisis? And I'm not talking censorship, but it is a big question that we have to think about if we are going to do better when the next crisis hits.
I have stronger adjectives than rascals, but I appreciate that. Thank you, Elise. Dr. Lapook?
Yeah, I agree with what's been said so eloquently. I think, it's frustrating to know that even if you explain it, what you think is perfectly, it may not matter to a lot of people, but we still should go ahead and try to do it. And I think it's really important to try to explain the science, which is tough to do. You've got a minute 20 for an evening news piece or a minute 30. So I do think that social media is important. I do think that embracing science is important. I do think that having empathy for people as they push back and say, no, I'm not getting vaxxed, and to say, then there's been some research on this, and just say, instead of just saying, do it, say, what are your questions? Rather than saying, what are you going to say to them? Listening. And I think it does have to be one-on-one. And I agree with what's been said about, going down, not just to the head of the NIH, but to people who are trusted. And finally, with Dr. Badili said, I couldn't agree more. At the end of the day, this pandemic is not going to be over for anyone until it's over for everyone.
I know that those are the kinds of things you're thinking about for the empathy project that you're working on, John. So that's really cool. Governor Thompson, you know a thing or two about winning hearts and minds. Closing thoughts?
Yeah, I do have some. Why don't we take some individuals that were in intensive care because of this insidious disease. And they'll come out of there and they'll say, I wished I would have got a vaccine. The people that are in intensive care are people that didn't get the vaccine. Let's be honest, let's be upfront and get some of those individuals. I'll bet they'll tell the most compelling stories of what they went through. And if they only had taken the vaccine and get that circulated to the people that are so afraid of the vaccination and the vaccine, we need to convince America that the vaccine is the best way to go. The vaccination, it will help America get us back to normal as soon as possible and get it over for all of us. And I don't think we're telling the story correctly.
Dean Williams, final thoughts.
Yes, I would say it's really important that we tell the story and we don't shy away from telling the full story that is complex. There's a complex causal web here that has an interplay of poverty and inequity, the social determinants of health, the unequal distribution of resources that can keep us healthy and well threatens all of us. And I think this pandemic has made that very clear. It's made clear how dependent we all are on each other, needing a healthy workforce that can commute to the workplace when they are not able to work from home. We need to have equity and access to broadband, because if the response to a pandemic is to retreat home and to do homeschooling, then all children need access to broadband. Inequity in access to healthcare. We have seen an incredible surge in the need for mental health services. And, you know, when you think globally, there's no country that has had as much capacity to meet the mental health challenges. So I think we have to not shy away from this intensely complex causal web of the social, infrastructure, workforce, political, as well as biomedical determinants of health for a population at the individual, the family, the community, and the global level.
We've learned so much in the past year and a half, and I've learned so much from you all today. Thank you so much for taking part in this incredibly important and timely Paley Impact. Be sure to support the Paley Center and consider becoming a Paley member by visiting PaleyCenter.org. Thank you all.